Welcome to the Heart Rate Variability Podcast, where we explore the exciting science behind heart rate variability. The material discussed in this podcast should not be taken as medical advice. Please check with your medical provider to make sure any suggestions or strategies are right for you. Visit us at the OptimalHRV.com website to learn more about the Optimal HRV app, download a free copy of Matt's book, Heart Rate Variability, and also get show notes and additional resources around heart rate variability and its applications.
Hello again, and welcome everybody to another episode of the Heart Rate Variability Podcast. Jeff Summers back along with my friend Matt Bennett.
Hey, Jeff.
Matt, how are you?
Good, man. Been traveling again. So
It's your last week in the mountains, man. You're gonna come back to Denver here soon.
I know, but I'm coming off the mountains. As the Buddhists say, I'm coming back to the marketplace with hopefully my less than enlightenment, but good heart rate variability score is still intact. So I think you're giving me a little break on the weather, but boy, it's 70 degrees right now. It's beautiful. So yes.
96 here in Denver. I'm
yes.
glad it's 70 up there. That's good.
Well, I was in DC. I know we're going to talk about that, but
that's right.
I got a reminder. I know you were in Florida recently, so
Orlando, baby.
We complain, but we complain in dry heat. So that is a thing. Because after a very mild kind of August day in DC where it was only like 86, 87, whew, that 100% humidity, man. I hadn't sweated like that just walking around in a long time. So
I remind you of the Midwest this time of year, my friend.
Yeah, I think DC even has it a little bit more than we did in Indiana. But yeah, I was talking to my mom. I think they were up at 96%. So I'll give them their proper props. Yeah. No thanks.
yeah, man. I don't know. Yeah, I'm glad that's not a thing here in Denver. Put it that way.
Exactly.
That's it. So you have been traveling. You mentioned you were in DC. Let's spend some time talking about that because I think it's very topical. Everybody who's been listening to our podcast knows your passion and our passion for professionals taking care of themselves and how challenged there are a specific number of professionals in particular to do that with the current sort of state of the world, healthcare being top of that list.
Yeah.
So, you went to the ECU conference, was it 2 weeks ago now?
Yeah.
And came away, what's the right, frightened? I don't know, what's the right word? You tell me.
I would say reinforced.
Okay.
So let me give credit where it's due. This is the Associations of Clinicians for the Underserved, and they do amazing work. So they're sort of a cohort of what's called primary care associations around the country, and they really deliver really world-class healthcare to historically underserved populations who often historically haven't been able to afford healthcare. And I'll be a little political here. There is still states that haven't expanded Medicaid and don't want the federal government to just dump a bunch of cash on them. So some are still doing this, but these are federally qualified health centers for the most part, and sort of the folks that help support their work. So just a shout out to the great folks at ACU and the Star Center. I put in my typical one that is hardly ever accepted: the future of trauma-informed care. Kind of, hey, I know this is 10 years ahead of its time sort of thing to talk about heart rate variability. And even though they did not accept it as a workshop, I just want to thank them, for allowing me to have a booth at the conference at no cost, to share the fact that I just recently updated and expanded our heart rate variability book. So I know shameless plug worked in there with a thank you, but when I was talking to them about just worried about this health inequity growing, that biometrics are really transforming how the way we look at health, with I believe HRV leading the way. There is still a barrier of cost there, that if you can't afford a $30 a month membership, or you can't afford a $400 watch, that folks that struggle with trauma, homelessness, poverty, abuse, the things I've dedicated my career with to, aren't getting this technology. And so they gave me a booth, and so I got to talk a lot of heart rate variability with folks. That was a lot of fun, as well as just learn. That's what I missed about conferences. It's there's those folks, Jeff. I don't know, you see this at technology work conferences, but there's kind of the folks that think they're too good for the workshops, that they always just hang out in the lobby. I'm one of those people that when I hit that level, Jeff, just hit me across the head, because I never want to be the person that says I can't learn anything from anybody anymore. So I just plot my butt at a whole bunch of workshops. And one of the things that came out of that, and there was a big federal presence there. HRSA is one of the big federal, funders of healthcare, as well with some other ones as well. And over and over and over, every sort of keynote address, part of every workshop attended. I did a address that was specific to burnout, but everything was just talking about how devastated the healthcare workforce is right now. And just to a rate that people are starting, I think, to wonder is, can a industry with a workforce this devastated sustain itself? And there's indications that, I know I saw something here in Colorado where at one point there was a survey that 52% of nurses were considering, listen to this, leaving the field of healthcare.
Yeah, right.
And
Not changing jobs, not switching from one facility or hospital to another, but just getting out completely and doing something different.
Leaving. I don't think we need to have a physician on to tell you that if we lose 50% of our nurses, we don't have a healthcare system. And so some of those numbers are playing out. Some of those early warnings are playing out. So I'm not going to say every industry is in the spot that healthcare is in, because healthcare, as I talk about in my talks, were some of the most burned out folks pre-pandemic. So we weren't doing good, along with social workers, along with educators,
Teachers,
lawyers, police officers, and just be kind to these folks, the folks that do kind of front desk, retail, and fast food sort of work. All those industries, maybe lawyers, not so much, but none of those industries have had a good last 2.5 years. If you think about educators, healthcare, retail, law enforcement, some of those challenges look unique to those industries, but are just devastated. So I thought, it'd be worth sharing a little bit about sort of what I've seen for maybe the industry impacted most by the last 2.5 years. But I think sometimes when you look at the folks that are most traumatized, most impacted, and I give my friends at ACU just so much credit for bringing this to the forefront of the conference. I don't know if they did that even intentionally. I think they did to some extent. They gave me a platform, and some others specifically look at this, but some of this is just like, hey, we've got HRSA, we've got legislative representatives, and this is what they wanted to talk about too.
Yeah, I mean, this is something that we've talked about in various podcasts, and as you said, not something that's surprising, but it really sounds like the level to which things have gotten was a bit of a surprise to you. And that I guess for somebody who wasn't there, what were some of the solutions that they talked about? I mean, what, talking about it as a problem is one thing, but it's another thing of what do we do from here? Where do we go from here? Was that part of the talk track or not?
A little bit. But here, and I'd like our listeners too to reflect on the systems that you work in as well. We have often gone back and forth. My experience in education, healthcare, social services, criminal justice. In other words, I haven't worked the front desk of a McDonald's, but I kind of, and I'm not a lawyer, but I check off a lot of the other boxes there. Looking at, what this is, the problem that we're hitting, and I think that this is an inherent problem sort of to American capitalism to some extent. And don't worry, audience, I'm not going to throw capitalism under the bus. I can't, but it's probably not, this is not the place to do it. Is the system was broke pre-COVID.
Right.
When you look at physicians, nurses, in a lot of these federally qualified health centers, pretty much everybody else is a social service or social worker type in there, at least could be relatively identified as one of those top three categories, depending on the survey you look at and what specifically, because sometimes dentists work their way in, veterinarians will work their way in to those lists as well. Sure. But the system, and I think where healthcare may not be unique, but I can talk about it because I know it so well, it was broken before COVID hit. And so there was this vulnerability there that has been really just brought straight to the surface and is in our face to see, okay, here's a broken system that got trauma on top of it.
Exactly.
Several different layers of trauma, several different times, and now we see what is left of that. So what I'm worried about with these really smart leaders is I think there's a temptation to talk about, let's go back. How do we recover to where we were before? But we were horrible at this
pre-COVID. going from bad to worse back to bad is still bad.
I know. I mean, we were the worst across the industries pre-COVID. So to recover back to something that was terrible,
needed recovery from.
Yeah, like I was trying to change the system before COVID hit.
Right.
With this, and so we can't pause. You can't shut down a health center. Health centers also are now feeling understaffed, as was predicted. So you're now in this really, I think, emergency spot where you need to give people time to recover, to at least get back to the horrible spot we were before COVID and everything else they hit. I think to just label the trauma of COVID misses the political environment that we've all been under, as well, which I don't care what side of the political, side you're on. It's been crazy. I think we could all agree upon. And that really hits when you talk about racial justice, criminal justice reform, hits the providers I work with as well, because that's the populations that they serve. I don't see, to answer your question, that there's a lot of solutions that are traditionally right there, especially when you can't give people vacation time. I mean, that's
yeah. Great point.
We've talked about this many times. You want to recover from stress, get the heck away from the stress. But right. Now that you're understaffed, what do you do?
There's just more stress.
Yep.
For
and we got a monkeypox things going on. We got COVID still hanging around. So it's not like the need for healthcare. It may have de-intensified.
An aging population, I mean,
yeah.
There's so many factors in place here that COVID, frankly, to your point, just accelerated things a little bit and made the spotlight a little bit brighter on the problem, but the problem's been there. And the external circumstances, aren't going away even outside of COVID. Just thinking about the need for healthcare for the baby boomer generation, and then it's just unprecedented, right? As these folks get older and
And you
transitioning.
just
So
mentioned it too, is what they're seeing as a massive retirement.
exactly.
Yeah,
Yeah, that's right. That's right. They're retiring and they're going to need care and
yeah.
just all those factors, right?
And I think for us, at least I know there's an arguable generation split between you and me that I love to tease you about. But, for us Xers, we're like, okay, it's our turn. We just didn't think it'd be all at once in the midst of the biggest workforce crisis ever that, hey, now there's upward mobility, just not quite the way we ever kind of envisioned, taking that next step in our careers. So yeah, you've got that happening as well. And I'll just give a lot of just admiration for folks that may have put off a retirement,
Yeah, right.
may have, because of age, added additional risk to their life and family to continue to see us to this point. So I'm not going to begrudge anybody for retiring, because I know a lot of people
Oh, absolutely.
disproportionately put their own health wellness on the line and put off their own retirement to meet the crisis, the public health crisis of our generation. So
That's it. So, I mean, as you all know, a lot of our listeners are in this space, social service, healthcare, some combination thereof. I mean, it's all one and the same to some extent. So, what advice do you have? I mean, you're somebody who spent some time in there, got out of it to some extent. You
yeah.
still work in the space, but not directly on a day to day. As an employee working with folks, you're training and empowering other folks to be able to do their jobs better. What advice do you give them? How do they manage what's going on?
Yeah, and so one is to think about this as I like to think about putting on, and we've touched on this in previous podcast. What is the recovery plan? Thinking about
Yep.
this like a strategic plan of how to use the next. And I still think we're at 6 to 12 months, and I've been giving my talk ever since I kind of saw this mentality. And you got to kind of think back a while now. I kind of saw it's like, oh, when we get the vaccination, that will cure all our problems. And I'm like, that's not how trauma works.
Right, you
It
did. You
does. It
mentioned that in
doesn't.
podcasts, June of 2020. Yeah,
Exactly. That's
absolutely.
not how this works. And we're in a relatively, I think if we look back and said, wow, we've got so many people vaccinated,
Yep.
that,
Both boosted.
yeah, I mean, even though it may not ever seem like enough, we're in actually a really amazing spot. I think if we were going to predict how quickly we would get here. So
Right.
ever since that, I've been like, no, it's not going to go away. A vaccination doesn't heal the trauma, the mental health crisis that our workforce is in. And so I still think, even though my message has evolved over time with the situation, maybe somebody took me up on that idea way back about a year and a half ago to start thinking about this. But even if you took my training, you established everything, the wave of stress and trauma, was going to hit. And now that it has, and this is where I really think it's looking at something like a heart rate variability. Like, how do you know you're keeping your workforce healthy? And I think that's a question that we have to try to challenge ourselves with. And I just want to put out there, I think there's a reason we have been in the more for-profit business world with innovators than healthcare social services, because when you're in the midst of a crisis,
Sure.
innovation is really difficult. Finding funding for it, finding time for it, doing implementation science, all that, changing habits, all that is really difficult. So, I've really encouraged people to think about things like time off and taking a 12-month calendar out and saying, okay, we know we can't have more than one person out in any given week right now. And because we are also short staffed, how do we ensure people are getting time away from this work? Bringing in therapy in house to do that. Rethinking self care. I mean, this has been a
That's
little
right.
bit of a soapbox. It's a term that has died and has died so amazingly quickly that it's no longer okay to blame it's an individual failure for being burned out. And that makes total sense with everything we've talked about on the show in the past of no, really, the organizational aspects are going to lead to burnout. Now, are there individual habits that can build resiliency? Absolutely, yes. So having people think about their personal recovery plan, this needs to be, we need to hold the dilemma of your personal behaviors. And as we've talked about, uh, nutrition, movement, sleep, those are the foundations for good heart rate variability and resiliency to stress. That's going to, you don't do those things, your stress response is going to struggle anyway. But then from organizational perspective, what resources do we give to help people recover? And I really hope, even though I get right now that it's tremendously hard to implement anything new when you're trying to bail out the ship, to say, hey, let's take on a new initiative. There's not a whole lot of energy for that. But I think, I would love, you've got to track this in some way. You've got to measure, if you bring a therapist in house, is that helping with this recovery? And then, why I would just love to give everybody, access to some of this science right now is I think, the HRV biofeedback, resonance frequency breathing. I know, and we've talked about this so much on this episode, but that was my recovery. I was just amazed as I started to really integrate that 40 minutes a day, 20 minutes of really good, approved practice, and then 20 minutes as I watch. I binge watched Westworld, season 4 of Westworld. Holy hell. All I got to say is season 3 kind of lost me. Audience, if you gave up on the show, you got to go back for season 4. No plug for me. I'm not in it, but I have never seen so many plot twists within one season of a television show in history. So anyway, just to say that I may have been taking my HRV as I was rewinding because I may have missed something, but really getting that to people, giving people time to practice HRV mindfulness, the biofeedback, maybe during the workday. Could you give them 20 minutes for that focus time? Maybe getting people hour lunches because we know that's good for their stress response, rethinking in healthcare on call, trying to get supervision in there. So I think that there is a real plan. I think the real hard part is, one is the staffing shortage, and 2, trying to change how do you integrate a supervision structure that can help people co-regulate? How can you get people on vacation? How can you maybe start to measure heart rate variability to ensure these are working? I think I'm never going to sugarcoat anything. That's doable, but it's really hard. And where I really worry, Jeff, is our leaders are burnt.
Sure.
Not like leadership has not been, really, I would say, incredibly adversely impacted by this. And I think this is across professions as well, because we've been trying to keep people safe. We've tried to keep people healthy. We've tried to keep people working.
And that's it. Leaders trying to find people to work,
And so you've been holding on to your own stuff, dealing with your own stuff, because we've all these stressors, politics, civil rights, pandemic, all this, land war in Europe, whatever your trigger is, we got all it for you.
Exactly.
Try and deal with our own mental health while supporting systems that needed an extraordinary amount of leadership, management support to survive. We were just talking about, and the restaurant right across the street from me that has great vegan tacos, great vegan pizza, and for a while had a happy hour starting at noon with killer margs.
That's right. The only pizza and taco joint that you ever heard of.
They really closed their doors. So, so it's just, I think we've been through this extraordinary time. And, if you're listening to this podcast, I think being a little creative, like what can we do in a way. And I think heart rate variability, it's giving people daily feedback. People are focusing daily on their wellness. The RF frequency, mindfulness, biofeedback. I mean, those were just such huge pieces of my own recovery because the HRV data told me I was doing terrible about 14, 15 months ago. I was treading water and I was pretty good to get there, but
Sure.
I was starting to go down, and here comes Ina and that functionality, and I've got data to show I'm in the hundreds somehow nowadays. Like, I've
Yeah.
actually been
Yeah.
able to increase that during a time where I'm trying to keep, I don't know how many companies I'm doing now, but like 18 companies that I started, a lot of those with you during the pandemic. It hasn't been the easiest time to launch an innovative tech company or a nonprofit or, you know, everything
All of the
else.
above. Exactly. Write 2 books, all of those things.
Working with a team on 3 different continents. I don't know if we've counted time zones at this point, but uh,
A lot
yeah,
of them.
yeah.
Absolutely.
So I mean, we need advocates for this, and this isn't a shameless plug for Optimal. I hope we provide you the tool. Yeah, I know we bring
Sure.
the tracking and the RF assessment into the same app, and hopefully at a very affordable, like I said, by less than $5 a month, which has always
That's
been a
right.
focus of ours as well. So, and
Yeah.
we can set up teams on here. We can set up organizations. All that stuff was built into our original vision for this. So, I really, if you're listening to this, I probably don't have to sell you that HRV is such a powerful tool. If we can help in any way, like I said, we launched March 8th, 2020. So we were kind of where we wanted to be. I mean, I have fantasies about what if we started a year before, but I don't have quick epiphanies. I would have loved to have been a preactive, or proactive solution, but hopefully we can be for those that are ready. And like I said, we've incorporated a nonprofit. We can write grants with you. I do training on leadership, staff resiliency and wellness. And again, not shameless plugs, but we're here to help
That's right.
because I care about these people. Not only do I care in healthcare and social services and education, it's the people that are working there, these social justice healthcare warriors, the educators who are still in education because a lot of folks are leaving. But I care about the kids they serve. I care about the families they serve. I care about the individuals that they serve. And if these folks go away, as with most things, it's those in the struggling school districts. It's those
Right.
struggling with poverty. It's those that might not get addiction services or mental health services because those are in demand now, and people in the middle upper class are going to be raising the rates on that. So,
Yep.
like I said, we're here to help. Even if you just want to talk through some of this with us, don't hesitate to reach out because if we can help in any way, or if I can get you to somebody who can, I definitely will as well.
That's it. That's well said. I think it's a good way to end. I mean, ultimately providing visibility and awareness is sort of what's going on, and
Yeah.
making people realize, look, we're in the situation. We got to find ways to make things better, improve, and offer tools to do that is about all we can do.
Yeah, because what we really want to do, Jeff, here is there's an idea that I don't think we've talked about in a while called post-traumatic growth. And
Right.
it's really, there's resiliency. And if you're still doing what you're doing, you're resilient, right? We get up, we bounce back in the face of hardship. But there's an opportunity in all this. And this is where in my clinical work, we call it post-traumatic growth, but we've all been through a lot of trauma lately. And we know that if we really spend the time to heal, not just recover
Right.
will maybe mitigate some of the more severe symptoms, mental health, medical, social, cognitive symptoms of burnout and trauma. but we really want to gain strength and wisdom from this. I hope we don't have another
Absolutely.
pandemic like COVID. It doesn't seem like monkeypox is
Right.
probably going to quit. I'll just start knocking on wood everywhere. It's a different disease in many ways, but so if we have time, how can we grow from this experience? That we can be stronger for the next challenge that face us. So there's a real opportunity here individually, organizationally, collectively, to gain resiliency. If you've ever been through a hard time, probably don't want to go back there, but you're stronger today for having gone through that. And
That's right.
that opportunity is staring us in the face, but it's not easy. It's going to be really difficult. And so that's the challenge, is to come back with lessons learned, with increased resiliency, because hell, if we can survive the last 2.5 years, just watching the news today, there's a whole new dose of stuff going on right now, at least in the US.
Always is.
Hopefully we can survive and maybe really address some of these larger issues going forward. So that'll be my last words, Jeff. Thanks for doing this with me. I'm glad to get this message out there.
Absolutely. Glad to be a part of it. Thanks everybody for your continued interest. Optimalhrv.com. If you want to learn more about what we're doing, reach out. As Matt said, we talk to a lot of people just to help them. They might not be using the app, but they want to understand HRV better. They want to understand biofeedback training. They just want to learn. Reach out. We're more than happy to spend time with folks that want to spend time with us. So.
Yep. And hey, I got to plug it. The updated and revised version
Oh
of
yeah, I was
heart
going to
rate
say
variability. We're not kind of pushing this out aggressively because it's nice when somebody buys your book every once in a while. But, you can get the PDF for free if you go to optimalhrv.com, sign up for our email list. Love to get your feedback on it. It's got 100 new pages. So even if you read the first one, there's a lot of expanded, updated material in there. So if you're thinking you might have been traumatized throughout this, like most of us, we wrote a book on that. So please get it. I'd love to get your feedback on it too. So
that's it. Well, thanks, Matt. Thanks everybody. We'll see you next week.
take care, everybody.